Welcome to the Fraser Coast Property Brief, the podcast where property, development and business leaders share what's really happening across the Fraser Coast. Each episode brings you insights into local projects, market trends and the people helping shape the future of our region. Welcome to the latest episode of Fraser Coast Property Brief. Today my guest is Dr. Nick Yim, a local doctor and the immediate past president of the AMA Queensland. So welcome, Nick.
Yeah, thanks, Glenn.
So today we're going to talk about the important conversation around the Fraser Coast. It's growing, it's ageing. Our average age is now 51. Much of our population is in the over 65 area. This creates serious questions in our region around health services, around workforce, around specialists, and around housing to support it. So I want to dive into all those things. And I want to do it from a property point of view and how that actually integrates with the health, because those two things aren't separated. They both got to work together, and the main things we need. So I might start off a little bit of background about yourself, Nick, and your role here as a doctor, and what is the actual AMA and what was your role there?
Yeah, so I've been on the Fraser Coast now for over a decade, general practitioner, so I deal with a lot of chronic disease, and I saw a lot of challenges in the region, and that is the reason why I entered medical advocacy. That's where AMA Queensland comes into play. So we are the peak medical body for healthcare professionals, and we advocate for medical practitioners, but more importantly, we also highlight the challenges patients and the community face. So we have direct lines to our state government, and whilst we don't agree and see eye to eye on most things, it's something where we're always respectful in those discussions, and which is great. It's great to advocate for our community.
So you're trying to lobby for changes and more health services into our area and across Queensland?
Absolutely, and that's something where we know that on the Fraser Coast, as you alluded to, it is a growing population. It's also ageing, and what I see is, unfortunately, my patients are waiting longer. Often they have to travel long distances, and it doesn't have to be that way. So obviously it does take time, and it needs to start somewhere.
Yep. So let's jump into it. Our number one issue here is we're an ageing population. We've got an average age of 51. The state average is 38. If you look at post-COVID, our biggest growth sector is the over 65 range. And from a medical point of view, what does that actually mean for the region? Is it pressure on hospitals, doctors? Where's the big problems with this ageing population?
It's all the above. With the ageing population, we know that comes with increased chronic diseases. That includes your diabetes, COPD, your lung diseases, heart disease, the need for joint replacement, cancer diagnoses. And what that means is we need to see doctors. And along with that, we need the healthcare professionals to go along with it. Your nursing, allied health, physio, pharmacists. At the same time, we need our hospital beds, we need our aged care beds. So there is no one solution, but what we're struggling at the moment is definitely that health workforce. When we're seeing the immigration of the health workforce, whether it be come from interstate, from the metropolitan areas, overseas, a lot of those clinicians might be a little bit older, they might be mid-career to late career, and obviously there's a shelf life for that. So what we do need to do is also recruit, I guess, the trainees who stayed longer and at the same time may have their families here and then obviously retire here potentially down the road.
Yeah, like talking about that, we had a demographer up here, Simon Kustamahar, about a year or so ago, and our health industry constitutes about 22% of our employment in the area. So it's the biggest employer by a long shot. But what Simon was saying, over the next 10 or so years, probably a third of that employment is at retirement age, and they'll be dropping it out and actually go into the retirement bucket. But we're not getting that younger generation replacing it. So we're heading for a cliff within the next decade. Is that what you're seeing within the health industry?
Absolutely. That's one of my biggest concerns is whilst we have a lot of housing that is targeted for the over 65, which is a really big positive because housing is really important. Unfortunately, that means that, say, your healthcare professionals in your 30s and 40s, they're finding it difficult to access this area. And that's what I'm hearing from my colleagues in the metropolitan areas such as Brisbane, Sunshine Coast. They do want to come up here, but they're not really, there's nothing available to them to buy.
All right. We'll jump in that in a minute. So let's start with facilities. We've got existing facilities, we've got a private hospital, public hospital. what are we needing for the growth of our region, and the ageing population? What are the key facilities or the gaps in our market at the moment?
So on the Fraser Coast, we have the public sector, so Harvey Bay and Maryborough Hospital. In the private sector, we have Uniting Care, which is St Stephen's, and also the Surgical Centre as well. They do a great service to our region, but at the same time, we do need to increase that infrastructure. We need investment in the area, and we've spoken before, it'd be great to have a cath lab. So for the people who has heart attacks, we don't need to fly them out to Sunshine Coast or Brisbane. We know if we can deliver the care in our region, it just means there's less travel for those individual patients. They get better faster, and obviously less pressure on those families.
Yep. So obviously ageing population. Is the cath lab the number one? If you had to get one new thing in this area, is the cath lab the number one thing, or is there multiple things like oncology and mental health and different things? What's the...
Yeah, I think there's multiple aspects. There's definitely many things that would be beneficial, things that can utilise our existing infrastructure. So things such as public haematology, so treatment for lymphomas, leukemias, ear, nose, throat publicly. The closest public ear, nose, throat is in Brisbane, and that's not acceptable. At the same time, things like public respiratory would be highly beneficial for those lung cancers. So there's many things that would be quite beneficial. And we've spoken about previously a public-private agreements where specialists come up here working privately. Why can't they do also public work as well?
Yep.
They just need the incentive there.
And also the emergency section in a public hospital, why can't they push the beds across to St Stephen's as well when they're overloaded, rather than a 5-hour wait outside the hospital? So the key seems to be health workers, and I put them in there's probably 2 or 3 health working categories. We've got a lot of health industry workers that work around retirement villages and things like that. We've got a lot of that. We've got that nursing type staff in hospitals. Then we've got the specialists. Is the problem just with getting a specialist up here, or is it getting your nurse? Where's the biggest gaps in the workers?
It's actually every single industry.
Yeah.
And if we look at aged care, so the residential aged care facilities, the nursing homes, their challenge is the nursing and also care staff. The challenge for them is retention of their staff. There's a big rotational staff mix, which can be quite frustrating for patients, the clients, and also the employers. So that's one element. The other big challenge, as you alluded to, is obviously the subspecialists. And across the nation, there is a shortage of medical specialists. It takes decades to train. So obviously there are different recruitment strategies from a national perspective, but that's something where, unfortunately, from a regional town, we need to be attractive to ensure that we can get the best of the best up here.
So it leads to the next, what makes us attractive? Obviously, housing product is an issue. We're running short of housing product. I don't think we make the right housing, especially for that younger nurse or whatever else that just wants a 2-bedroom apartment or whatever else. We keep building 4-bedroom houses on estates, and they don't want to be mowing lawns on weekend. They do shift work, everything else. Does our housing product need to change to attract the people?
Personally, I think there needs to be an adjustment. As you alluded to, someone who might be a new graduate or a newly specialist, they still want to travel. They don't want to spend their time managing an acre block. They don't want to be doing mowing the lawns. They want the luxury of being able to lock up on the weekend, fly to Brisbane, Sydney, Melbourne, or overseas, and have their weekend off. So I think that's definitely, we do need an increased number of potentially those, I guess, high density living, as we call it. Similarly, I think it's opportunities as well. So we acknowledge with infrastructure on the Fraser Coast, it takes time, but also the entertainment value as well. We need to build that as well to keep people having their, I guess, weekends in town.
So you come here 10 years ago, so you would have been a younger doctor coming up from CBD Brisbane or wherever else. So what attracted you to come up here, and what are the elements that you're missing when you turned up here? What's the lifestyle elements that are really still missing here?
So the reason why I came to the Fraser Coast was for training purposes. So I grew up in Brisbane. I thought, let's take an opportunity to train on the Fraser Coast. And 2 years later, I decided I'm going to make Fraser Coast my hometown. The great things about the Fraser Coast, it's easy access to transportation. You don't have to be stuck in peak hour traffic, going to work every morning, it's only a 5-minute drive, as opposed to when I lived on a Brisbane, Gold Coast, it's often 45 minutes. That's one great advantage. I guess the pricing point was great. It's something where it was significantly cheaper to enter the housing market 10 years ago compared to Brisbane. But similarly, you do realise is we do have many things here. You can go out and have a drink on Esplanade, you have the restaurants there, and you realise with the modern age is I didn't miss the big supermarkets, the shopping centres, didn't have to have the Myers and David Jones, because you do that online now.
Yep.
So that's a big change.
And so, are we adapting? Are we getting enough restaurants, bars, outdoor leisure type things for the younger generation to come here?
I think there's definitely a bit of a deficit. There's something that we can increase the entertainment. We are seeing that growth. The Torquay Scarness area on Esplanade, we are seeing that growth there. The new business, hospitality, the entertainment. There's a long way to go, I think, to keep that here. But at the same time, I think we need to highlight the opportunities of what people can do on the weekends. The beach, the water.
Yeah, I did a podcast with Sarah Farage from Council, acting on behalf of the young professionals just a couple of weeks ago. And she made a very valid point. It's about the messaging we give as a community. We got signs up the highway of older people going into retirement villages and things like that and whale watching, but we don't do any of our messaging for a young couple or a young executive or that nurse that makes it really attractive. Say, geez, I want to go live up there. How can we change our messaging to bring more doctors to the region?
I think it's just more sort of a marketing material.
So what's the message? If you're 30 again and you want to come up here, what would be the message that would attract you?
The message here is the experience is just top notch. Not just from a clinical perspective, but also from a lifestyle perspective. It's still top notch. Pricing, it's still very, very competitive. I still think the cost of living on the Fraser Coast, it's much better than, say, in Brisbane, Gold Coast, Sunshine Coast. And from the clinicians, for the doctors, nurses, healthcare professionals, there are other opportunities here. We have the universities, research opportunities, just as much as what we have in big cities, I think.
Yep. And 5 or 10 minutes to just about any place of employment in here
absolutely.
Too, which is a big thing when you live in the cities. Let's get on to a couple other topics. We've had a new Wide Bay Hospital Health Board in just the last month or two. What influence does the health board have on our hospital and our growth area? What do they actually do?
Like all boards, their key role is the strategy moving forward for the region, which is the Wide Bay region. It's a great opportunity for a bit of a turnover of boards. We know with all boards in all industries, once boards have been in the same, I guess, for extended period of times, it can get a bit stale. But I think it's a great opportunity to look at what's our plan for the future, taking into account the growth, the areas of deficiencies, and see where we can grow. And I think the key message that I have for the Wide Bay Health Service Board is that what is our long-term strategy? We do need investment, and sure, there might be areas that we might be running thin on funds, but we need to invest for the future. Otherwise, we can't recruit and retain those future workforce.
Yep. I see there's a few more Hervey Bay identities on the board. Like I've always had a bit of an issue over the past decades that our health system was stuck under Wide Bay and it's been very Bundaberg centric. We've had Bundaberg heads of boards, we've had the funding. Previous government were going to push into a level 5 hospital in Bundaberg. We seem to be the second cousin, even though Hervey Bay's growth, we're a bigger city than Bundaberg as population, and our growth rate is far bigger than Bundaberg. They don't seem to be taking in a 20-year strategy and setting up Hervey Bay as the number one centre in the Wide Bay. Do you?
And I think that's probably one of the complexities of our healthcare system, and that's something where it's at the hospital health service level, but obviously what I've seen definitely at the state and federal levels, when there's all these interplays, there's always competing interests. It's always challenging, and obviously with healthcare expenditure, it's always going to go up. And I acknowledge that money is a finite number. Yep.
And I see recently been a bit of controversy around the electoral boundary changes. Our state member David Lee did want to lose the Hervey Bay Hospital out of Hervey Bay and put it into the Maryborough, which makes a lot of sense because, everything's about lobbying and it'd be very hard for a Maryborough representative to be lobbying for a Hervey Bay and Maryborough Hospital at the same time because there's only one bucket of money, where David could actually really lobby hard for Hervey Bay. What did you think about the electoral boundary changes?
Yeah, so I spoke to David Lee and John Baronis about this issue separately, and one of my concerns was also the workload for that MP. We know that healthcare, there's a lot of challenges, and even a lot of my patients will go to the MP to go, hey, these are my issues. So if we had both hospitals in one electorate, that means that workload for the MP will exponentially grow.
Yep.
And as you alluded to, advocacy is really important. So hence having, I think, separate electorates makes a lot of sense.
Yep. So let's have a look into the future. 10, 20 years' time, we've got this growing population. There's obviously a cliff where the ageing will start, dying off. And actually this year, it's the first time Hervey Bay deaths have outstripped the births in a natural form without the immigration. So we're already starting at a tipping point. If we don't fix our imbalance of our demographics, where do you see the health industry and the health workforce in 10 to 20 years' time in this region?
If we don't have some solutions moving forward that's sustainable, unfortunately, the delivery care may change. That might mean a reliance on a locum fly-in, fly-out workforce, which is not ideal. We want people living in the area, servicing the area, because they actually know what services are available.
Yeah.
Whilst I acknowledge that currently there are some fly-in, fly-out services which do a great job for our community, I think in the long run, we know that if we can train our clinicians or healthcare professionals, if we train them in the region, they're more likely to stay in the region, and I guess they have that connection to the area.
Yep. Do you see any real changes with the advent of AI coming on? I've read quite a few books on AI, and COVID saw us in the first thing. We started doing teaming with doctors, and we're starting getting this virtual care and diagnosis. AI is going to exponentiate that whole thing, and some of the things are saying, well, you'll be able to put a blood sample in, and the AI will actually give you a proper antibiotic for your specific issue rather than broad spectrum. Do you see that's going to make some major changes in healthcare in the next 10 years?
AI, it's already made a huge amount of changes in the healthcare industry, also in many, many industries. But we also know that patients like that human touch, the person to speak to, the emotional connection, whereas I don't think AI can deliver that. We will utilise AI definitely to improve efficiencies, like what we've done with technology, telehealth, going through the internet. I think it's become a lot closer, which is quite handy. But I think with the checks and balances in the healthcare industry, we do need to get it right.
Yep. So, advice, if we're going to make changes, what are the key changes before we go in that cliff? Is it housing? Is it the attraction of younger workers? Is it our universities with the courses bringing the pathways in? Better health precinct, like there's been discussions that the TAFE precinct could become a health precinct, and then TAFE come back down next to university. I think David's pushing that one at the moment. What's some of the structural changes we need to do to actually fix our healthcare going forward?
We'll go through a few big headlines. So number one is infrastructure. We do need to ensure that there's adequate healthcare infrastructure moving forward over the next 20 years. And it requires strategic planning moving forward. If we have that healthcare infrastructure, whether it be a cath lab, a research site, that's also going to attract the specialised staff. So we know that with specialised staff, if they can see a strategy, they'll be able to move to the area. So that's number one. Number two.
Just on that one, does that mean a bigger or a second hospital or something, or can it be done under current infrastructure?
It potentially can be done under current infrastructure, but it's also having those stakeholder meetings with the universities who's going to do that research. Right. So obviously we've got UQ here, we've got University of Sunshine Coast here as well, so those are the benefits, and a TAFE as well, so see what they need as well.
All right. And the rest of it, are university courses matching our future health workers, or are we mismatched? Because we seem to be a mismatch in the other sectors, like, town planning, engineering. We're not getting all those things. Is health a mismatch with our courses?
Yeah, so training pathways itself, it's really important. The biggest thing is if we can start training more of our doctors, nurses, allied health, pharmacists in our region. All the research has shown that if they train in a region, they're more likely to stay in the region. And I think that's something that we can definitely boost up our numbers.
Yep. All right, so final question. You can take off your AMA hat now, so you're not bound by those rules. What would be your advice to local community leaders, that goes from council to state to federal government leaders, on changing, what do we need to change to better our healthcare and for, what's the turning point, or what do they need to be focusing on or lobbying for?
So from a healthcare perspective, one of the number one thing is we need to increase that Medicare rebate. Obviously, out-of-pocket expenses are growing, that gap payments are growing, and if we don't change and increase that Medicare rebate, unfortunately, people are going to pay more and more out-of-pocket expenses. The other key thing is we do need a private sector in our region. If we don't have a private hospital, for example, that means is we're going to have less opportunity to recruit that workforce. So we need a viable private and public service. And that's one of the concerns that I have, is given that the increase of private health insurance, the loss of the rebate for some of the over 65s, we are going to see, consumers drop out in private cover, and that is a little bit concerning.
So was anything in this federal government budget last week that actually going to change any of the rebates or any change? I know there's a health fund that's coming out. Is it, and they're doing emergency clinics, things like that. Anything going to benefit us?
I don't think it's really going to benefit us acutely in the short term. It was a little bit disappointing for our region. Yeah,
it seems like we're in the wrong side of politics at the moment, so I think we got left out. I saw David Batts standing next to a bare tree in Canberra saying this is what we got from the budget. All right. Thank you very much, Nick. Any last words or any advice on the health industry for Fraser Coast?
Yeah, I think the key thing here is I would love to see, a bit of a change in the housing arrangements. I think high density, I think we need to definitely look into that. The other big thing is we do need to invest in our region from an infrastructure perspective as well in healthcare, and also investing into the workforce so we can train, but also retain them in our region.
All right. So the big takeaway is we can't do nothing for the next 5 or 10 years. We have to do something different to what we've been doing, otherwise we've got a cliff coming. So I think all the leaders in the community need to stand up and actually understand that our ageing population is now not a benefit but a concern going forward.
100%.
All right, thank you very much, and thank you for listening to this latest podcast. Check us out on Facebook, YouTube, and your favourite podcast channel. Tune in again next week.